So, yeah.
So good morning, everybody. We're coming to you live. This is Terrell Agnew, and
Hey, how you guys doing?
this is his workshop, and we're part of Mask Relief, and trying to help everybody understand why masks are so important right now. So I'll let him take over. So tell us a little bit about what we're doing here today.
Well, what we done is if you can look around, we do shirts normally, but we got called on last week, and so what we're doing is going to be making a lot of stuff for the mask, the Nurses Foundation that's set up, and we're also providing the industry as much as we can. A lot of the stuff we do in the retail line, the fabric we have, since a lot of the apparel industry is closed, is going to be prints. We got some really cool ones for the girls, and then we have some really cool ones for the guys. And a lot of people like the novelty ones just because it's really super fun. We're going to be doing some of that. She's going to pick up immediately. Then we're going to do solids, and also brought a pattern that we're going to be working on today so they can cover up their masks, which normally they throw away, but they have to keep so many times that if they cover it, it's going to save it a lot longer than their normal being. I joined up with her because she's an advocate for nurses, and when I heard the stories of what's going on, it's something that we have to do because it's kind of all hands have to be on deck for this one. We also got some mills on board that are going to deliver some fabric, and so we're going to be able to support the home sewers since there's so many of them out there that can't get material. And in the meantime, we'll be working overtime and Saturdays. So as much as we can make, we'll be making in the next until they get adequately resupplied, which they're talking about May. The shortage comes from where the stuff is made is they have their own emergencies, and they went through all the masks, the surpluses before this even happened. So, we're making them here. We make them locally, and we can make about 8,000 a week, which is not enough. But we're enlisting some other people that are volunteering their time, and if everybody's on board, we can make a lot, and we'll survive. We'll do what we can. And there's a lot of people have reached out to do this. If you know anybody who's interested in doing the home sew, you can reach her.
And my name is Julie Boyer. So what we did is I'm a registered nurse, and I've been a nurse for 22 years. And my entire career, we've always been told, mask up. This is I don't think a lot of people understand the difference between the masks. This is an N95. When people talk about N95s, it's called a 95 because it blocks out 95% of the viruses. And it has to be fit tested to you. So every year, nurses, respiratory therapists, medical assistants, anybody who wears an N95 has to be fit tested. This is not something you should be wearing to the grocery store right now, or ever really. This is only for medical purposes. And everybody is scared right now, and I understand that. And the fear is real, and people really do need to start taking this very, very seriously. This is a general surgical mask. This blocks out 50 to 60% of the viruses, and this is a great tool if you are going to the grocery store or if you work in medicine right now. This is what's being provided to the majority of medical workers because this is really all that we have left. These N95s are meant to be a one-time use product, but almost everybody that I know across the United States right now is using this product all day long, and sometimes for days and days and days on end. So when Terrell came in on Friday and we met, our idea was to make protective coverings for these N95s. And then that way you can get more use out of the N95 product by laundering the mask that's going to be custom fitted to this mask in particular. But our even bigger project right now is making a mask that this mask will fit into. So we've been hard at work designing this mask that will actually be in lots of different colors. Terrell owns an Aloha shirt company. He's not a mask maker by trade, but due to the current emergency, he's switched over all of his operations now to making masks for everybody. So the masks that he's making for us in medicine are different than the masks that people can purchase, and people can purchase the masks. Everybody can off of his website. They do not come with these inside. They're just fabric masks. However, the greatest thing about them is 70 to 80% of the people that carry this virus have absolutely no symptoms at all. So that means you are going to be a transmitter. If you wear one of these simple cloth masks over your face when you go out in public, you're going to decrease the rate of transmission. So even though you may not think, oh, an occasional little sneeze or a cough, if you're out and you touch something, this virus can live for 3 to 12 hours on a doorknob, on a toilet seat. So it's really important that everybody keeps their mouth and nose covered as much as possible, because even though you might not have any symptoms at all, you could be one of the ones that's transmitting this to everybody and not even know it. So that's why it's super important that everybody wear a cloth mask. The other thing that we realized in this is simple air conditioning filters. These, if you buy the right ones from Home Depot, Lowe's, Grainger, Amazon, if you can find them, these will actually protect you against 90% of the viruses. They are more effective than your surgical mask. These are 50, these are 90. So this is just your basic air conditioning grid that you put in, that you change. Should be every 3 to 6 months. I'm a bad homeowner.
I would say, I also want to bring up something too, is a lot of people hoarded these masks and they're in desperate need at the hospitals.
Yes.
If you're one of those hoarders, turn them in because they need them more than you do. This one here that we did, she's talking about, for them, they have none of these masks, so they're gonna be using air conditioned filters.
Yeah, so people that don't have these masks, if you don't have them, don't go out and purchase them. Go out and purchase these air conditioning filters, rip them apart, they're accordion up, and cut them up. Out of a 20 by 26, you can get 72 filters out of it. That's 58 cents a piece. My husband and I broke it down last night. This is much more effective, 90% versus 50%. And these, the medical professionals need these. Please, 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 if you are not in medicine, do not run out and buy these.
Yeah, these are going to be really effective. Most people are quarantined, and if you go to the store, it opens up on them, and basically, it's gonna cover most of your face. The CDC has issued stuff for the nurses that are not going to get these because they are not going to be adequately resupplied until May. And that's just in the medical, not to mention everybody else. You can do this. We have them in fashionable colors, and it will cover you. Now, she was talking about a filter, and those are really good filters. We've done our own. There's a fabric filter it's called Pellin, but it's very, very tightly woven. These are 100% comb cotton, like a 205 thread count, which is really tight. It's combed, so it's soft. It's a lot softer than most fabrics. Let me feel this.
Yeah.
They're amazing fabrics. I mean, they're on our $70 Aloha shirts. Basically, you'll be wearing our 2020 line. But they're all in cool colors. We have, you can be fashionable and be clean at the same time. And if you run out, I don't think they're going to be allocating any of the...
And then for our girls, nice bright pink Aloha prints.
And from what I hear, they're not going to be allocating any outside the medical industry. You can be very much protected. A lot of the people are already using them, and then you can save it for the people who are wearing them 8 hours a day and that are required by law. They're actually using these as covers, and that's already, they have a protocol. She was saying that the one time, one use, that's what it was for the last, how many years?
Oh, I've been a nurse for 22 years, and for 22 years, I mean, every education that you ever go through as a nurse or a doctor says this is a one-time use product. But in desperate times right now, we don't have that choice. We couldn't just use this one time, or else you wouldn't have it anymore. Now, N95s right now in the hospitals are only being advocated for people who are treating COVID positive patients. They're not being used in clinics. This is a hospital use only right now because there is such a short supply. I just read an article that said there's 37 states that already have none. There's none in overstock. There's enough for everybody to have one that takes care of COVID-19 patients. And that's if nobody else gets COVID-19, which we all know is not the reality. Right now in California, it has turned into a firestorm for sure. It is definitely spreading through our state. The best thing everybody can do, wash their hands and stay at home. If you don't have to be out, don't go out. But if you do go out, wear a mask. A simple cloth mask will work. For those that don't have any sewing experience, like I don't, they're for sale. They're $10 a piece on the website.
What's the website?
The website is High Seas Trading Company, and it's all together, High Seas Trading Co.
It's Co. Yeah.
And co.com. And just type in the search bar masks, because you're going to see all those great Aloha shirts. But if you type in masks, I think there's about 12 different styles right now up on your website.
We just added another 6, and we're going to be adding more.
Okay, so there you go. Lots of different things. So what we started was as a fundraiser called Mask Relief, and you can go to our website, maskrelief.com. What I wanted to do was I wanted to provide masks to healthcare providers that didn't have any. So people like Mark McMillan, Steve Olis, so many incredible people in the off-road industry have reached out and donated money towards this because they want to make sure that their healthcare professionals are adequately covered. And I can't say enough about all the people that have reached out and donated to our great cause.
I'm going to say it again so they make sure that you know the website you guys set up.
Oh yeah, it's maskrelief.com. So it's not just for people to donate money. I also want nurses, healthcare professionals, anybody who needs a mask, please, there's an inquiry form on there. Send me a form. Today, my son and I, we're going to go to Arrowhead Regional and drop off masks. We're going to go to another hospital in Fontana and go drop off masks. Nurses are letting me know that they need these masks. So if you let me know, we'd be more than happy to supply them to you.
I have another, I just want to add something.
Yep.
That every one, they're going to be getting masks for, we have a very favorable pricing for them. So, for every $10, we're going to match it. We're going to donate it. And then on top of that, we can only sew so many. I'm going to tell, after talking to her and a couple other at the Pomona Hospital, which we just made 3,000 for, we donated 1,000 and made 2,000 for them. And what I'm going to say is that this is something I thought we could handle, but really the problem, as she said, how many states don't have them?
It's like 37 states have already run out of N95s.
So 37 states, there's 6,200 hospitals plus how many, probably hundreds of thousands of small clinics that don't have anything. If you guys know of any home sewers that want to add to this, we have already set up a fund with her Mask Relief and the donations that we're doing, my family's doing, and so many people have reached out to help this cause. The home sewers, for every $10 that you donate, it's going to make, I'm calculating right now, it's going to make 36 to 40 masks. That's a lot. That's for $10. And the fabric, we have people on board in the mills are completely on board with that and are giving us favorable pricing, which allows us to get the materials to them and provide people, because a lot of people are out of work right now, can't afford it, but they want to join the cause. They would be paying $10 a yard for this fabric. We're going to be buying it in the thousands of yards. And everything that gets to urgent need, I'm going to trust that she said there's such a need down here. She's going to do pickups and distribute them, because it's really, we're going to be at our complete max 6 days a week. And whoever we enlist, which a lot of people already reached out. And I think, if our armies of home sewers want to get involved, the people who are reaching out, and probably double what production we have, or at least do a couple thousand masks. And when you have nothing, these ones are rewashable. You can wash them as many times. We use commercial grade elastic, and you can hand wash them or put them in a washer. We recommend a net bag, what you wash bras in, or anything that's sensitive.
And don't use fabric softener.
Yeah, these are good fabrics. They'll last a long time. They're reusable, and this is basically the CDC they have a protocol when there's short supplies. So these are acceptable by them. Cloth masks were used for over 100 years before the disposable. And what's going to happen with these for general use for the nurses, the CDC, it's basically a stopgap measure, meaning that until they get adequately resupplied, which is going to be about May 15th, before just the hospitals get them all to where it's safe. In the meantime, they're going to be having to do this, and they can fit in. They can be sterilized very easy. If you're going to buy them for yourself, you can either wash them or put them in the hottest setting of the on the iron, and what does the virus die at? Like 60 Celsius, like 150 degrees?
I believe so. I think it's 158 degrees. So it's really important too. Everybody that we're going to be giving masks to in the medical industry, we are going to put a sticker on the bag that says these must be washed every night. So the masks really should be washed every day. If you're just running to the grocery store, honestly, you probably don't need to be washing them every day unless you're going to the grocery store every day, which you shouldn't be. But they do need to be washed every night. Very, very important if you're in the medical industry. That way you're not retransmitting the virus onto other people because it's not sitting in your mask. But I can't stress the importance enough. And there's a lot of people home right now that are kind of bored. If you're bored and want something to do, maybe this is your time to learn how to sew. You know, I will be happy to ship the product to whoever wants to make these. I've committed myself to driving down here to Laguna Hills to come pick up product at least twice a week, and I will do this until we're out of this horrible situation that we're in. It's hard to decipher the news right now and figure out what's real and what's not, but I can tell you, being in the medical industry, this is real. I mean, it's hitting our counties, and it's just going to get worse and worse and worse as the days progress.
Yeah, it's as real as it gets. Like I said, I go, we can easily handle this problem. We can do 10,000 a week, and then I talked to Julie, and I'm thinking maybe 100,000 a week would be adequate, but a lot of other apparel manufacturers have joined. I have one other person who's going to, a lot of people got out of work, and now that they're doing safety, they'll be able to sew more. Like I said, she set up a foundation where, again, at $10 we'll get 36 to 40 masks, and if everybody joins up, it will make a massive difference just in the local area. And then we have, believe it or not, people in the Facebook have been tagging. So if you have a friend that sews, tag them. We will get them the materials. She set up a foundation. She's got doctors in there that have donated, and she said in the off-road industry, which she's a big part of, they've donated. And with the money they've donated already, we're looking at somewhere in the range of 12 to 15,000 masks. And $10 will make a difference, $20 will make a difference. But if we all join together, the nurses should not be coming out of pocket on this, which is a nightmare. They should be focused. They shouldn't be cleaning their, what are they doing? How many times do they have to clean this? 6 to 8 times?
Yeah, I've been used. So these we're cleaning with alcohol now. That's the recommendation. So I've probably cleaned this one, I don't know, probably 10 times already, which is unheard of before. I mean, like I said, it was a one-time product. So our very first home sewer in the off-road industry is going to be Shirley Minsk of PCI. She has agreed that she's going to attempt to make these. And hey, if I can make one of these, anybody can make one of these. It's a really simple pattern. We'll give you the pattern. It's something great that you can teach your daughters how to do, or your sons. Every boy should know how to sew.
Now's the time to do that too, because people have time. I want to mention one other thing that hasn't mentioned yet, because the emergencies they have are emergencies. But in addition to that, the home sewers can always be of help, and tag them if you know one, because a lot of them want to get involved, and we'll get them the materials. We live next to our office is next to a retirement community. It's all locked down. Their caregivers can't go in there without protection. So not only do the frontline people are missing masks, which is our most important, and that's where they're dropping all the medical supplies, and there's volunteers doing that. But even in your local retirement facility, there's a lot of doctors right now doing telemedicine for a 50-cent mask, because they were told to stay away from patients because there's no mask to go around.
Right.
Now, it's ridiculous. That's how bad it is. It's basically horrifying that not everybody is going to get COVID, but they might have a heart attack, they might have a stroke, they might, they might tear muscles, or they might go in. And right now, they're not getting the care. A lot of them aren't getting care because of a 50-cent mask. And if you donate to them, she's going to make sure it goes to good people. And from what I've heard, she's on the job and passionate in getting other people involved. So the movement may grow. If you want to get involved also, you can get involved. Just reach out to her and ask Mass Relief if you want to do home sewing, and we'll get them the materials.
But if you do have PPE like this, say you have these, you came across them, somebody gave them to you, you stole them, you want to give them back, this is the time to give these back. There is a website called hashtag Get PPE. There are hospitals on there, and big hospitals, Children's Hospital, Kaiser, Memorial, all kinds of hospitals. You can actually drop off your PPE, even if you only have 2 masks. I don't care if it's 1, 2, 1,000. You can drop these off at those locations, and that's hashtag Get PPE. Super important, because if you have it sitting at home, you don't need this. Please donate it. Please, please, please.
Again, this is a 50-cent mask.
58 cents.
58
that is now
cents.
being charged $8 for, if you can even find one to buy.
You know, also the fact is, when you have a doctor with a COVID patient with alcohol, when he could be saving lives, again, turn them in. This is like a patriotic duty. Don't even shirk on that, because they're doing it's the most stressful situation most of them ever had. The hospitals have to rearrange everything to keep people like that are giving birth, or diabetics, or people that are high risk, which is a lot of the population in hospitals is elderlies. They have to do all this. They don't have time to clean masks. Also, you know, if you can get involved, you can do this. Just to give you an idea, and she can verify this, one hospital, Pomona, that we had done work for, they're using close to 11,000 a month normally to be in compliance with what would be good hygiene. 11,000, and they don't have barely enough for their staff. And like she said, if this grows, we're going to have a big problem. They're expected to get them by May. Everybody's in double production. They're allocating them though, and like you said, there's not even near enough.
There's not near enough. The other thing is this too, is not just for nurses and doctors, but for our EVS staff. I mean, our EVS staff is on the front lines. For those who don't know what EV staff is, it's environmental services. That's our housekeepers in clinics and in hospitals. Those are the ones, people keeping everything clean. They don't get to wear these, and sometimes they don't even get to wear these. They're wearing nothing. They're going out there with no protection on at all, which is terrible. We're also starting to run out of wipes too, sanitary wipes. So my other mission too is not just doctors and nurses, but also our EVS staff, all of our back staff, our medical office assistants, respiratory therapists, everybody that it takes to make a hospital run, all the important stuff. I want to get these out there. So if you would like to sew some of these masks, please get in touch with me, hashtag mask relief, or maskrelief.com, or you can just PM me, Julie Boyer, or you can call me, 661-332-2559. Please don't call me after midnight, till 5 a.m. Let me sleep a little bit, but get in touch with me. I'll be more than happy to ship you out a package or run it over, or however it is. If you want to sew masks, please let me know. I'd be more than happy to get you the equipment. But even that, we still need money too. So if people just want to donate money like Mark McMillan did, like Steve Olgas, I mean, they're going to be responsible for literally maybe saving tens of thousands of hundreds of thousands of lives just from a small donation. Because if people donate just even $20, $100, $1,000, it can go so far and help so many people. So don't feel like any contribution is too little. And of course, there's none that's too much. But so thank you very much for listening. If anybody has any questions, you can go on High Seas Trading Co. And buy these masks. They're $10 each. And like I said, these will protect the basic person just going to the grocery store. They come in all kinds of fun colors. And then for our nurses, please get in touch with me, and we'd be happy to donate the masks to you with the funds that we've already raised.
I was going to say too, real quick on these, we did add an extra filter. It's a fabric filter. It's tightly woven. The other thing too is, you know, part of the thing is that you don't want to spread it yourself. You know, and what she was saying about the staff, the hospital staff, they're not getting anything. And these guys, there's 3 times as many inside the hospital now. They're wiping down. If you go in there, you will not see one room where they don't come in every 15 minutes, right?
Yeah.
They're cleaning it up. So they're frontline too, because they don't want, they don't have a way to test right now. So they don't know who's coming in there that is spreading it. So these guys are doing double, tripling up just to clean it up. So when she says that they need it, they actually do. And they're doing it in every room, and it's just important for them to do that. And she was letting me know that the need is so great. We probably, every hand on deck, and we can probably solve it. And like, I appreciate, because she can do work that we can't. We're 10 days into it. We had a couple samples made I heard about it on for the last couple weeks since this blew up, that there was they went through 4.5 billion, they said, worldwide in the last month. 4.5, that's billion, which is a lot. So when it finally got to here, the worldwide supply is short. And again, we can't stress it enough. She's on board as an advocate for all nurses.
For everybody. I want to see everybody come out of this. I don't want anybody to lose a loved one. The idea of somebody that we know, and we have a very tight community in off-road racing, but in medicine too, I don't want to see anybody lose anybody. So if everybody works together, stays home, washes their hands, makes masks, wears a mask when you go out in public, do what you're supposed to do, then we'll all get out of this hopefully fine. But if people don't do those things, this is just going to keep stretching on and on and on. So do what they're telling you to do. Stay at home and sew masks and be with your kids and enjoy that time. I'm working harder than ever. Terrell's definitely working harder than ever.
We're around the clock, but a lot of it's because we have a production that's really, really good, and they're on the board, and they're proud to be part of a mission that can actually save lives rather than make them look good on the beach. I was going to say, to stress it again, the CDC has they set up a website, and it's coronavirus.org. It has a lot of best practices of cleaning masks. Again, nothing's going to protect everybody, but it's part of a larger strategy. Get gloves for the stores. You're going to want to. The best way is to stay at home, like she said, for at least the time being. They don't need any more people in the hospital than they're already going to get. We have no idea the scale of the problem. Do what you can, donate, support everybody in any way you can that's involved. A lot of the people, I'm going to tell you right now, across this community right behind me, you want to turn around or go to the front and just go and go. This one here, from there's probably 30,000 residents there that are not getting health care because of, or limited because their caregivers don't have masks too. So the problem is really big. Everybody there's usually 70 plus. They're high risk. It's on complete lockdown. They're getting supplied what they need, but it is urgent, and it's the elderly that are the most at risk. And when you see whole communities that have nothing to protect themselves, it's a big problem. So, like I said, we can build them. She can build them. There's people nationwide that do it. The quilting market's very, very large. That's one thing we do deal with, because we've always donated for like quilts for the veterans, for the VAs and stuff. There's enough people in this country easily to make 100,000 masks a week, and that would make a big dent.
Yep. Anyway, thank you guys for listening, and please get in touch with me.
Websites.
Maskrelief.com or Julie Boyer, either one. PM me, go on the website, send me your request, nurses, respiratory therapists, EVS, and I will make sure that your hospital gets masks. Home sewers, please get in touch with me. I'll be more than happy to supply you with the materials needed to make these masks. And if you don't need to do either one of those, but you'd like to give us some money, you can either do PayPal, we've set up a GoFundMe, or you can directly, if you don't want to go through either one of those, and I understand people don't, we have a direct method of doing the transaction, and Terrell will be running your credit card. It's totally secure, and we'll send you a receipt too. We're not a 501(c) right now, so it can't be a tax write-off, but we can definitely send you a receipt so you can see exactly where your contribution is going to. I will also keep updated on the website as to the money that's coming in and the production that's going out, because I know a lot of times with websites, people sometimes, and with fundraisers, are a little uneasy about where the money's going. I want to be 100% transparent of where all these funds are going and what the money is being used for. So please get in touch with me, Julie Boyer. You can text me or call me, 661-332-2559, or go on the website, maskrelief.com. Thanks, guys.